So welcome everybody. Thank you for joining us for another video. Today I have the pleasure of having Doctora Ibarra with me, and she's going to answer a couple of questions. Welcome, Doctora.
Hi, thank you so much for having me.
Thank you so much for taking the time out of your busy schedule to meet with me and answer a couple of questions. I hope that these questions help future and current students. So whatever and anything you have to say, we will take it more than happily.
Of course, I honestly feel like I needed that because I wasn't I didn't really have anyone to talk to me like this. So I'm glad I can be a little bit of help, at least so that you guys can, learn from my mistakes, if anything.
Awesome. No, yes. And it helps to hear like different perspectives, different journeys. Everybody's a little bit different. So let's get started with the first question. Where are you from and where did you go to undergrad?
So I'm from Charlotte, North Carolina, and I did undergrad at this small university called Appalachian State, and this is in Boone, North Carolina. I majored in cellular and molecular biology with a minor in chemistry, so I took the very basic route into pre-med.
Secondly, would be regarding UAG. When did you start?
I started in January of 2017. I graduated in December of 2020, so almost a year and a half.
Okay, I wanted to ask you your next question, which is where did you match? So congratulations on your matching.
Thank you.
We are very happy for you. Seeing an alum go on and match successfully it's like a big deal. So if you could tell us a little bit more about that.
Yes, so being in Mexico for 2 years and doing my rotations, away from home, it really made me realize that I love home, I love North Carolina, and I love the East Coast. So I knew that I wanted to match somewhere close. And luckily I got interviewed and, I got a really good vibe from that place I was eyeing from day one, which is Vidant Medical Center, ECU, Brody Medical School, Internal Medicine program. And so I was lucky to, have matched into there. It was my first choice. I couldn't sleep the night before, but I'm so happy and so glad and so excited to start.
I bet. That's amazing. That's amazing. You matched home
Yes.
That is honestly, I feel like that's my goal, matching where you see yourself in the future and the community that you aspire to, provide for. So
yes.
that's amazing. Congratulations again. And and internal medicine. So I was wondering if you can tell us a little bit about internal medicine. For those who don't know what internal medicine really is and how long that specialty is.
Yeah, of course. So when I was in medical school, I actually asked one of the professors if he could tell me more about internal medicine, because it can be a little confusing, especially if you're just starting and if you haven't really been around doctors in your life. And the way I interpret it is kind of like you meeting up with like your friends, right? And you find a puzzle and you want to put it together. And so typically you assign roles for each one of your friends who's participating in the puzzle. You kind of go, hey, you should do the corners and you should do the edge and you should do center right, center left, center mid. And so internal medicine is kind of that way, in the sense that you take care of those inpatient and also outpatient patients, and in a way that you are collaborating with every single other doctor, because you see a variety of disease, but you also have to make sure you consult with cardiology for the cardiology disease. You do consult with infectious disease, pulmonology, neurology, and it's kind of like the bridge between a patient being recently diagnosed or recently admitted and the subspecialists. And internal medicine, you can do several things. You can work as a hospitalist, so you'll be the doctor that you see typically in movies taking care of the patients who, just got a surgery done or just got admitted and have to stay in the hospital. But you also take care of patients if you want to have your private practice outside of the hospital. You could also have that practice, And the third option would be if you want to continue down, your career as a subspecialist. So it's 3 years of internal medicine. And if you decide you want to go into any of the subspecialties of that umbrella, which include cardiology, pulmonology, ICU, neurology, endocrinology, gastroenterology, critical care, it's a lot of them. So if you want to go into any of them, it's that fellowship. So for example, right now I'm interested in endocrinology. So I would have to do 3 years of internal medicine residency. And then once I'm done with that, 1 year of endocrinology. It varies depending on what you want to do and if you want to just go into practice, hospitalist, or fellowship.
Thank you so much for taking the time to explain it like that. I don't think I've heard anyone say it like that. What were your extracurriculars during medical school?
When I started medical school, the first thing I heard about was the American Medical Student Association, or AMSA, which I knew that I had to join just because you learn more from, your upperclassmen and just overall having interactions with people. And so I was able to be a member of AMSA. And then a semester after, I was, fortunately and luckily, and I'm so grateful that I was elected as a vice president for the organization. So I was able to do that as well. On top of that, I don't know if you have heard of Genetic, which is a nonprofit organization that helps people in rural communities outside of Guadalajara and just around, nearby towns, and provide medical health. And so you go as a student and help out, doing clinical care to patients and helping prescribe medications or do vaccinations or just overall taking care of them. So I was able to do that as well with Dr. Sugeli. And lastly, I was fortunate enough to collaborate with the national side of UAG. They have an organization called Sociomed, and they do research and they do volunteer stuff during the weekend. So I was able to also participate in that.
That's awesome. I don't think I've heard of that group. What did you say it was called?
Sociomed. So SOCIE and med as in medical.
Awesome. Thank you. Okay. So you kind of mentioned research. That was my second question, if you did research during medical school.
Yeah. So during medical school, I was able to help out in a lot of that sociomed work. However, it didn't translate into, as a participant. So no, unfortunately, I had no research in medical school. I did have research in undergrad, but not in medical school.
Oh, okay. Oh, I think I misunderstood. So Sociomed is not for research.
They do research, but I was a participant and they couldn't really include me in it, I guess. Like I wasn't participant enough, which I was still grateful because I was still learning,
Okay, so next question would be, did you have any mentors? And if so, how did you find him or her?
So during medical school, as you're learning, you find out that you need so-and-so to continue growing and such. I wasn't aware or I didn't think about having a mentor at the beginning. It was until I went into my clerkships that I considered someone advised to me, hey, you should look for a mentor. They can guide you and they can help you out, especially if you know where you want to, what you want to do. But during my third year of medical school, I didn't really know what I wanted to do. I was split between pediatrics and surgery and internal medicine and geriatrics, which is, internal medicine nonetheless. And so I didn't want to go into finding a mentor without really knowing what to do. And that was my own fault. I was thinking, oh, they'll probably think that I don't have my life sorted just because I don't know what to do. I was fortunate to have, a lot of the attendings help me out and give me advice and all of that. But I would highly advise to look for a mentor and don't get in your head thinking, that if you don't really have your life planned out, that they won't help you. That's what mentors are for. They help you, help you figure things out. So don't make my mistake. Really reach out. And the thing I've heard most is just, going to that person and just explaining to them that you're really passionate about what you're doing and what you want to do or what you want to pursue, and always show that you are resilient, always show that you are someone reliable. They're happy to help, but don't be knocking on their door every single day as well. So, it's a balance.
So you found your mentors through your clinical rotations?
Yeah, my attendings, they helped me out. It wasn't like an official mentor per se, but they all gave me great advice. And, if you ask, you'll find the answer. And they're always so willing to help. Just be the best version of yourself, and always, be presentable and just show that passion that they want to see.
Now we're transitioning a little bit more into your clinical years. So I was wondering what you believe are skills that were expected of you for your rotations.
So from my experience, it really depends on the rotation, but your set must-have skills are always going to be patient presentation and SOAP and just writing, reports, clinical reports and all of that. So you always have to have that in mind. Obviously, like people skills, social skills, which are, a given. But for example, my first ever rotation was cardiology. And so for cardiology, I had to have, skills on reading the EKG and just learning how to interpret it, knowing how to do EKGs, like physically, put the EKG machine on the patient and all of that. For my pulmonology rotation, which was my second rotation, I obviously had to know how to read X-rays because that was very important for that rotation. And also how to do spirometry and how basically the basics of pulmonology medications. And yeah, overall, it really depends on the rotation. And also the attendings. Some attendings will be more relaxed on what they want you to do and they want you to know, and some of them will be more on top of you, wanting you to improve. For example, during my OB-GYN rotation, the attending I was working with, he was very interested in us getting our patient presentation, to be the best. So he was always giving us advice on how to improve, basically giving us a well-rounded evaluation on our patient presentations every single day. So I feel like I came in knowing, 10% and walked out knowing a good, 50+% more than what I came in with. So like I said, really depends on the rotation, the attending, but always go into your rotations hoping that you can learn something else, and always ask questions, because even if they don't expect you to do something, it'll just reflect better on you if you're always seeking for more and to learn and to, have that curious mind.
Where did you do your third year clinical rotations, and did you stay there for your fourth year?
So I did both third and fourth years in Las Vegas, Nevada, at the University Medical Center.
Did you have all of your experience outpatient, or was it a mix with inpatient and outpatient?
It was sort of a mix, but I think it was more geared towards outpatient. I was so glad to have an internal medicine rotation as a whole, inpatient with the wonderful Dr. Sinha. So yes, I was doing rounds and I was, with a team and I was presenting patients, but this was an experience that I specifically asked for. So what's great about Las Vegas is that their team is always willing to work with you and adjust, your rotations in a way that obviously goes with the curriculum, but they also give you options. Hey, do you want to do an internal medicine, or do you want to do like separates, and so on and so forth. So yes, I had outpatient mostly, but I had the opportunity to also work with some physicians inpatient. Also, the pulmonology will take you inpatient. So that was really great.
So it's more so speaking to the UAG coordinator, correct? About what you would...
Yes. Yes, you always have to have a good, a connection with them, contacting them. They will contact you just to like keep an eye on you, to make sure you're doing well physically, mentally, to make sure you're up to date with everything that's going on. And they're always willing to hear you. And, if you if you maybe don't feel like geriatrics was the rotation you wanted, the elective you wanted to go into, they'll help you find, maybe the rotation you really want to go into. But always, following the curriculum, of course.
Or since you are going into internal medicine, do you recommend for someone that's going to aspire towards that goal to do their internal medicine rotation as one of their last core rotations in their third year? Or do you think it matters in terms of which experience they get first?
I think it doesn't really matter when you have the experience, as long as you have a good experience and you make use of all of the resources, from time to your attending, the ancillary staff, everyone around you, the residents. I had my internal medicine rotation. I was my third rotation of my third year. So like, as I came in for my clerkships, it was my third rotation. And so it kind of helped consolidate that I knew what I wanted to. I was interested in internal medicine. Like I said before, I was kind of split between pediatrics and surgery and internal medicine. And getting that idea of what internal medicine is gave me that perspective, so that when I went into pediatrics, which was a rotation I had during my second semester, I said to myself, no, I don't think I want to go into pediatrics. I still like internal medicine more. And that happened as well with surgery. So it really depends on what you're interested in. I was interested in 3. So it helped, like I said, it helped me consolidate my decision, even though, I was still a little confused as to what I wanted to do. But I think what's most important is really understanding, like, getting into your rotation, walking into those doors and knowing that you have to absorb everything that's going on around you, not just information wise, but like see the interaction between physician and patient, between physician and ancillary staff, between residents, and just like their lifestyle as a whole, because that will be your life. So understand that aside from the medical perspective and aside from the information and like learning and, studying, there's this other side that's going on around you that you also have to be able to, understand and observe. And if you're sitting there and you're seeing that the doctor, has to deal, for example, for me, while in my pediatrics rotation, I saw that the doctor has 2 patients, a sick patient and a mom, and the doctor has to talk and deal with both patients at the same time. So that was one of the things that I was like, I don't know if my understanding or what I want to do in medicine clicks with having those 2 patients, like I said. So that's one thing that helped me realize I didn't want to go into peds. And it was, my personal opinion, obviously. But just like being able to analyze how those doctors, go around their lifestyle and their work style and their workload and the patients, and just being able to analyze all of that, I think it'll give you a better perspective than when you take that rotation, because you'll take all of your core rotations your first year anyway. So and you don't have to make a decision right away, but like I said before, if you're still having troubles, reach out to the residents, to a mentor if you have it, and if you don't, look for a mentor, or just like your attendings, they're always willing to help.
In terms of rotations, sometimes UAG students, or just in general, we go into rotations without having taken our step 1. And so in terms of balancing out the workload of, maximizing both clerkships and studying time with step, I don't know if you have any recommendations on how to balance that and what rotations to try to go towards.
So mainly all of the rotations you have your first year, which are your core rotations, they will be, day-long rotations. What I was doing is I would wake up, go to my rotation, during my break. Sometimes I would have like a 1 hour break. I would eat lunch and then do a QBank. And then when I was finally back home, I would review that QBank and then do another QBank and review that other QBank. So I would at least have to, try to do 2 QBanks a day. Hopefully, if I was in a good mood, 3. But it's just, finding that balance during your first year. It is until your second year that you have a little bit more freedom, because that's when you do your electives, or at least, in my case. Also, because that's when COVID started, it was my second year, my fourth year. A lot of the rotations had to be through Zoom. And so, for example, I was due for a dermatology rotation. And it was pretty easy because it was through Zoom, a couple of hours a day. And so I had plenty of time to study. I think the nutrition rotation was also doable in terms of studying, because it was a half-day rotation. And so it really depends on the rotations, and it also where you are doing your rotations. But it's mostly the electives that will give you more time to study. The core rotations will be a little more, all day long kind of deals.
So with that said, what electives did you choose for your fourth year?
So I did hand surgery, pulmonary critical care, dermatology, neurology, ENT, nutrition, endocrinology, geriatrics, and that's all I can think of. I don't know if that's like all the rotations, all the electives I did, but
awesome.
If I think of any other throughout the interview, I'll let you know.
That's fine. I understand that it's a list.
And honestly, I don't remember ever saying, hey, I want to do this rotation for my electives, and them saying, oh, we don't have it. Luckily, all of the rotations I wanted to do in terms of electives, they had them. So I was lucky to be able to explore all of my options.
So overall, great experience in Las Vegas.
Yeah, I mean, it really depends on what you make it be. There's going to be hard days because, yes, we're in medical school, and you're going to be studying a lot, and you're going to have days where you're going to have patients that maybe weren't nice to you, but it really depends on the experience. And I try to look for the positives rather than focus on the negatives. So I had a great experience, and it led me to where I am. So I'm just grateful.
Thank you. And next question would be regarding STEP. When did you take step 1 and step 2 CK?
So I took step 1 at the end of my third year. It was October 20th, I think. And I took step 2. So originally I was going to take step 2 during April of my fourth year, but wonderful COVID took over. And all of the testing facilities had to close down. They shut down for the time being, and they canceled all of the tests that they had scheduled for the end of March, all of April, and I think even the beginning of May. And so we had to be rescheduled, and I ended up having my test rescheduled until September of that year. So September of my fourth year.
That's crazy. You were studying and then you had to change gears, huh?
So I had to keep studying. That's all that happened. But at the end of the day, it worked out. So here we are.
Yes, that's true. And you've successfully matched. So, so in terms of resources for step 1 specifically, what resources did you use, and do you recommend them?
Oh God. So for step 1, I made the mistake to have way too many resources, and it was a mistake for me, but it could help. It could be something great for someone else. I used all the Kaplan books, so I bought like the series, and I also did a little bit of the Kaplan lectures. I also used the Kaplan QBank. Then I did UWorld. I did that 3 times. I'm not kidding. And it was actually funny because I could remember some of the answers and some of the questions. So I'm not really sure if it works to do it so many times. I did first aid. I did this book called Secrets of Step 1, which I really recommend even for just your first 2 years of medical school, it really breaks down a lot of the things that, you know, that you learn in class. Also, I use the NBMEs, you know, I check the NBMEs, the practice tests, and I would study them. So it was just a lot. And at the end of the day, it was too overwhelming for me. So yeah, it helped me pass my test, but I think it would have been easier for me to have had less material, less resources to be able to focus 100% on all of them, because, you know, I wasn't able to finish, for example, that secrets book. So yeah, for step one, I used too many resources, and that's something that I learned to not do in step two. I learned that quality over quantity is best. And so for step two, I used UWorld. I did that twice, and I think it helped better because, you know, I wasn't memorizing the answers. I used first aid as a supplement, and I used the Enki flashcards, and that's it.
That's great. So you essentially kind of chose what worked out for you.
Exactly. Yes. I think for me, and it really depends on the person. Like, I'm a very distractful person. If I have too many things on my plate, it just helps me get distracted more easily. And also, the more things I have, the less I can focus on them. And so I realized that if I just had UWorld on my laptop and then my first aid open and Enki as a, you know, quick memorizing resource at the end of the day, that was it. So what I would do is just, you know, do 2-3 Q banks on UWorld, go over them, and then use my first aid as supplement. And then at the end of the night, I would do, I don't know, 100 to 200 flashcards, learning more from that than having to go from one thing to another, to another, to another. So that helps me, but I know that a lot of people work differently. So, you know, it may be different for some others.
What do you recommend to focus on for step two that's a little bit different than step one?
I was lucky enough to start studying for step two right after my step one. And I feel like I had a really good background on step one. You know, I obviously didn't know everything, but it was like a good background to start on my step two. And so cardiology, pulmonology, nephrology, all of the, you know, neurology, all of the basics, it was easier to study for. However, two topics that are not covered in step one that are really important for step two, which are surgery and OB-GYN, I didn't really have a good background on those, other than, like, you know, what you learn for step one, which is minimal in comparison to what you need to know for step two. So I had to focus a lot on surgery. I had to focus a lot on OB-GYN, and just overall topics like electrolytes, topics like emergency medicine, pediatrics. Those are things that you don't see on your step one. Good thing you don't really see any biochemistry anymore. You don't have to know, for example, specifics on hypersensitivities. You just have to know, you know, the basic differences on each one of them. So it's not so nitty gritty anymore. What is it? The biostats is still there. It builds up a little from step one to step two, but it's not that much. I think the biggest difference and what I had to focus more on was that surgery and OB-GYN.
I wanted to ask you because I personally am, so I haven't touched, I don't know if you've heard of the resource Sketchy Micro.
Oh yeah, I have.
Okay, I've recently heard a couple of like online, you know, students and stuff saying that they use Sketchy for their step two. And so I was just wondering, so does the information carry over?
It does, from step one to step two, yes. Sketchy, doesn't it do like microbiology and pharmacology?
Yeah.
Okay. I wasn't
a little
in what? In pathology?
Yeah.
I wasn't lucky enough to get it. Everyone talked about it in my class, and I wanted to be the hipster who wasn't using it. Just because I was like, I don't want to watch cartoons.
Yeah.
I do remember seeing people watching them, so I have a vague idea of what they look like. But for step one, I remember my friend saying that it helps a lot with memorizing. It kind of gives you like a good idea, especially if you're a visual learner. because I didn't use it for step 1, I didn't use it for step 2. I don't really know if it works for step 2, but if it does help you for step 1 and it gives you that background, I am 100% sure it'll help for step 2. Like I said, a lot of step 2 builds on what you know from step 1. So the better you know your material from step 1, the better you'll do for step 2.
Thank you so much. I appreciate that. Okay, so now that we're done with steps, how about your OET?
I took that, thank you. It was right before I started applying to residency. And I'm going to say one thing. I pushed it back for so long because I had this understanding that the OET was just an English test. So I was like, oh, I'll do that a month before. And so, yes, I signed up for it in August, which is a big, big mistake for multiple reasons. One of them is that they take 1 month to release your scores. Oh. So make sure you do it, within plenty of time before you have to work on your application, so you don't have to worry about that. And then second, it's not just an English test. Actually, it's not even an English test. There is 4 parts to it. So you have to do reading, listening, writing, and speaking. And so the speaking part, you have to do it as an interview. So it's kind of like you and I talking right now. I think it's a 30-minute interview, and you basically have to pretend to be a doctor, and your interviewer is going to be your patient. And so it's just that back and forth interaction, and they're grading your English speaking skills and your pronunciation and just overall how they understand you. So that one's really easy. The listening is also pretty easy. It's just you filling in the blanks from what you're hearing. The reading, it's basically, remember that SAT section where you had to read a paragraph and then basically interpret it? Mm-hmm. I don't know if you remember. So that's basically what the reading is. They'll give you a series of paragraphs and you have to interpret or answer questions based off what's given to you on that paragraph. Now the writing, that's what gets a lot of people. Basically what you do is you have to write a letter of referral to you as a doctor, referring a patient to another doctor. And they have a lot of things that they look for in grade. And if you don't include those, you get points taken off. So a month before I had to take the test, I found out that this was more than just an English test. And so the OET website has a lot of information and a lot of samples for you to go over and practice. And that's what I used. There's also an outside, and I'm not sure if it's linked to OET, but there's like a UWorld type of thing where you buy the program and they'll, teach you and they'll help you study for it. I didn't buy it. I didn't really think it was necessary for me. I just needed to practice on my writing portion. So I practiced, I studied for a month, practicing on the writing and such and such. When I did the test, everything else was pretty easy. I did the writing, reading, and listening on a computer at a testing center, and then the interview at home. But so what you need to pass is a B or more, and a B is a 350. So that's just their scoring system. I got an A for reading, I got an A for writing, I got an A for listening, and I got a B for the writing portion, and I got a 380. So it's pretty close to possibly failing my test. So my one advice for you is to pay attention to studying for it. It's not that easy. Or maybe it just wasn't that easy for me. I thought I did a good job studying, doing the writing part. Yeah. But it does, take you by surprise. So don't underestimate it. It's not just an English test. So if you feel like you need to buy that study program, buy it. If you feel like you'll be okay with just the the sample tests that they give you on their website, then that's what I did. I might have forgotten to include some things on my writing portion, but it was pretty close. So do study for it, just a little bit at least.
Yes, of course. Thank you for saying that. I didn't realize that it was very particular. Like, I think it's just the rubric probably that kind of got you, right? Like, I'm sure your grammar and everything was fine. It was just like, did you do this?
No, and not just that. I think they also focus on like, because you have to do like several paragraphs, like I think 3 at least or 4, I think from 3 to 5. And so I think it was also maybe the order of the paragraphs wasn't right. I don't know. So yeah, there's like a lot of like details that they want to see on that portion.
All right, thank you. I appreciate that. I wanted to ask you regarding the pathway. I don't know much about it. So all I know is that there's a pathway, either 3 or 4 that we belong to. And I believe that's an exam that you need before or to get your ECFMG certificate. Can you please explain? That's as far as I know.
Yeah.
Please.
Yeah, for sure. So yes, because of COVID and because we don't have step 2 CS and we have to take that OET test, there's this pathway that they have come up with, and basically it's the same thing together. The ECFMG certificate is given to you when you complete that pathway, and the pathway is basically applying for it. I think the application was $900. And it's contacting you, or it's a connection between your school and ECFMG. The school has to release your transcript, and you also have to have your test scores. And it's just the process. They process all the information and they give you the certificate. It takes about a month or 2 for you to get that certificate, and it is not required for your application, your residency application. But it is required for you to start your residency. So if you're applying in September, you don't really need it to be considered a good candidate per se, but you do need it for when you start your residency in July. Even though you don't really need it, for your application, you have to be conscientious of the time, because I think the deadline for me was, or for my cycle, was December 15th or December 29th. So just make sure you have, all that taken care of before the deadline. But it's a pretty simple path, or a pretty simple process once you have all of the tests and all of the, documents. And it's just literally paying and then getting that processed.
Oh, okay. I misunderstood. I thought for a second there, I really thought that it was an additional exam. Yes.
No, don't worry.
Okay. I went to the International Affairs Office the other day, and they mentioned that we were pathway 3 as of right now. But considering that I'm a second year and I won't be applying until 2 years or so, to come back and always talk to them, because it could change.
It may change. Yeah, I might have been pathway 3. I wanted to check if it says yes. That's probably it. I can't remember. There was a lot going on at that point.
I bet. No, thank you so much.
No problem.
Okay, so now in terms of applying for ECFMG certification, I saw that you have your certificate. Were you certified before applying for your residency application?
No, I was certified. I have a great memory. October 4th. So I sent out my application September 27th or 26th. The deadline was September 30th. And yeah.
Okay, so I wanted to ask you regarding matching. How many schools did you apply to?
Okay, so for me, I focused on a bunch of criteria, but 2 things specifically. So one thing, I wanted to stay within the East Coast, so that, you can apply to the entire country if you want, but I wanted to stay within that region. And my second was, I was only applying to internal medicine. So I was only focusing to schools with internal medicine programs, of course. I know it's different for people who are applying to 2 or more residencies or specialties, because if you apply, for example, for internal medicine and for family medicine, you have to apply to twice the schools, obviously, or twice the programs, of course. So having those two things, only applying to one resident or one specialty, and then wanting to focus on the East Coast, I applied to 102 programs. As an IMG, I read a lot about, that being a risk, because you want to apply to 200 plus programs, but I also wanted to keep an eye on my wallet and also, keeping in mind that I had my criteria and I didn't want to apply to a place that I just wasn't going to be comfortable in. So that's how I ended up applying to 102 programs.
How did you find out about these schools, these programs to apply for?
So luckily for us, there's a bunch of tools out there. I personally used Residency Explorer and Frida, which are basically database for your programs. They give you information from their location to the faculty that's being led by that program, to how many people have applied, what's the percentage for IMGs. It also talks about benefits, the criteria that they ask for, so minimum of steps 1 score, minimum of step 2 score, if they accept IMGs who have graduated 2+ years or 3+ years in the past. So there's a lot of things that you have to go through to make sure that you match, or like all of your things, all of your entire application matches with them. So you're not applying to and paying for a program that's not going to look at your application. And so also programs that meet your criteria. So I used those two. And also every time I was interested in a program, I would go into their specific websites. And their websites are really helpful too, because they break everything down as well. I know that there's also Match a Resident, which I have heard of, but I didn't use it. You have to pay for that one. I also used a lot of videos on YouTube. So if you Google up the program, they sometimes have introductory videos, just videos like I saw this video on a day in the life of an incoming resident to so-and-so program. So those are really helpful too. It kind of gives you a broader perspective of the program, and it helps you just narrow them down, because like I said, you don't want to apply to places you're not really interested in.
Yes, of course. And especially programs that will cut or not even look at your application if you don't.
Exactly. Mm-hmm.
So in terms of interviews, if you don't mind me asking, how many did you receive?
19. I was lucky to get, actually, I didn't get my first interview until day 3. So you send out your application, and it had been 3 days past when I finally got my first interview. But I had seen people on social media who had already had interviews the days prior, and I was freaking out. So don't freak out. It'll be okay. You'll see them, you'll get interviews progressively. I think I got my last interview in December. So you'll get interviews all throughout October, November, December. And I think people even get interviews in January. So.
Congratulations. 19 is
amazing. Thank you. Thank you. It was kind of hard at the end because I had to kind of schedule them, and they were intertwined. Like a lot of the dates were clashing, but it is doable. And I have heard people who have gotten, even less, and it's still doable. The match is it's an algorithm for a reason, so you don't need to have 15 plus interviews to get a match. Like I said, I was lucky to have that, but I think I would have been just as lucky if I had 10. And it really, so don't let a number bring you down, or it really is just a number.
In terms of interviews, how did you prepare for that?
So I watched a lot of videos of people who are residents now, or were recently residents who had, gone on to graduate and such. And they give you tips. They tell you how to behave. They tell you what to expect. And there are so many videos out there that tell you the most common questions like the first and foremost question is, tell me about yourself. Every single person will ask you, tell me about yourself. They will also give you ideas on what other questions may arise, and they will give you ideas on how to prepare. So what I did was every single video I watched and every single question they mentioned, I wrote it down or typed it down. And so I made a list. It was a list of basically all the questions, and I would answer them myself. Obviously, tell me about yourself. I created, a little paragraph of an answer. You have to keep in mind that these answers have to be 30 to 60 seconds long, maybe, a minute or two, depending on the type of question. So I answered all of the questions, and every day I would go through them, not so much to memorize them, but to make sure that I was answering them in the right way. You have to make sure you kind of chalk yourself up in those questions. So if they're talking about a book that you read, like, tell me about your favorite book. My answer was, Pride and Prejudice by Jane Austen, because she not only is a great writer, but she was pretty ahead of her time. She always talked about women equality, and just like, that's something that I truly value, equality, not only in gender, but so like I would kind of go off of a tangent and talk about my values, because they want to get to know you. So yes, I was answering the question, but I was kind of like talking myself up, I was kind of being like, so I understand and I support women's rights, and then I support equality. So that was something that was reflecting my personality, not only because of the book I read, but because of, I was adding more stuff. And that's what you have to do. You have to make sure you tell them somehow, in one way or another, about your values and your morale and just your life, how you interpret things, because they want to know you. And the more you present to them, the more they get to know you, and the better chances that they will, because they're grading you as they interview you. You'll see them writing down things. You don't know what they're writing down. But yes, so just that's what I did. I don't know if everybody else did that or everybody else does that, but it helped. At the end of the day, it kind of became, I was even switching up my answers, because in a way I was feeling confident. I mean, the first interview, I had a big old sweat patch. I think it was the first 3 interviews because I was so nervous. But you don't have to be. They're really understanding, and it is a professional interview, but a lot of the attendings and the faculty who are interviewing you, they make it so easy for you to relax. So just be yourself. I think at the end of the day, you just have to be yourself. Yes, prepare a rough draft of your answers, but don't memorize anything, because it'll just look robotic. Just remember the key points that you have to mention, and just go with the flow.
That's a great idea. You saying that you interchanged your ideas, I interpret it as, who you are so well that one question triggered an answer for another one that you had written down, but it's still you, so you kind of
you really have to know yourself, because they will ask you questions that you're not expecting. I'm pretty sure they did, but like I said, it's kind of foggy at times. So I would just, answer to the best of my knowledge, but always remembering to, and I would use some answers that I had, bullet points that I had for one question. And I was like, what, this works for this other question. So it's just knowing, that those bullet points, knowing yourself, knowing your application that you submit back and forth from top to bottom, and knowing what you want to tell them about you. These are the points. I want to tell them that I'm empathetic. I want to tell them that I'm reliable. I want to tell them that I am responsible. I don't know. So, make sure you emphasize on those things. And like I said, always be yourself. I think, for example, my first and second interviews, I was kind of like this the whole time. But no, you have to show your personality. You have to move your arms, and you have to laugh, and even like create a conversation. One of the persons I was being interviewed by, because these are Zoom interviews, a lot of them are at home, and he said, oh, I'm so sorry, my baby's crying, but my wife will take care of it in a second. And I was like, oh my God, don't worry, how many children do you have, how old is your baby? And I just kind of started talking about his life. So at the end of the day, it was just a conversation. He asked me a few questions, but it was just that interchange. And that's really what they want to know.
I think that they're going to keep the meetings in Zoom. Yeah.
I think they really like it. It just works better for everyone. You don't have to spend a lot of money.
Yeah.
You as an applicant.
Yeah, as an applicant, I really do hope that they keep it as a Zoom.
Mm-hmm.
I wanted to ask you a little bit about UAG grades, years 1 and 2. I was wondering if you think if they are important for your residency match.
What I do know is that from UAG, what they pay a lot of interest on, like the programs, they focus a lot on the Dean's Letter. The Dean's Letter is a document that you get from UAG. It takes about a month to be sent out, and it is sent out directly to the portal, to my ERAS, which is where you apply, where you create your application. So make sure you get that done, with plenty of time. But the document is just a breakdown of you as a student during your clerkships. So during year 3 and 4. And at the end, there'll be a graph, and it'll have 4 bars, like a bar graph. And it'll say, I think it's that first, second, third, and fourth. So it basically fits you in which bar, first being highest grades, highest evaluations, and then fourth being lowest grades and then lower evaluations. And it'll put you in one of those categories. So obviously it's better to be on bar 1 or 2 than 3 or 4. And I think that's basically what they get from UAG. I'm not really sure. They do get the transcript from UAG. You don't have access to it. So I'm sure they pay attention to the grades. But even if you don't have, and I think this works for any other career, even if your grades weren't good during first year or second year, if you have shown improvement and it is something you want to talk about, I think it just speaks more volumes that you were able to overcome, maybe that downtime that you had of like maybe not getting good grades to getting a really good Dean's Letter. I think it gives you that second opportunity. Because the clerkships grades won't be on your transcript, I don't think. So Dean's Letter will give you that chance to show them that you had growth. Like I said, we don't have access to it, so I couldn't really tell you if that affected me in any way. But in a couple of interviews, they did bring up the Dean's Letter, saying, oh, we got your Dean's Letter, and we found it to say good things about you. So tell me more about that. Tell me more about your clerkships, because they kind of go by clerkships. So they say cardiology. This student was able to perform EKG reading as expected, and yada yada. So they explain each rotation. So at some point, whoever's interviewing you may want to know more about that rotation. So I think the Dean's Letter carries more weight than your transcript. But that's my personal understanding.
Yeah, and in terms of the Dean's Letter, that's the MSPE, correct?
Yeah, MSPE.
I've heard. This is how I learn things, from hearing people. That we as UAG students, we file or we complete a rough draft of what the MSPE is based off of an accumulation of all of the clerkship evaluations. Yes? No? What was your experience?
So you don't complete it. They will send it to you. They will write it up themselves and they will send it to you for you to review. The way I interpreted it back then was that I was going to just double check and make sure that all the information matched. I wasn't really sure if I could change anything other than maybe wrong dates or wrong names or something like that. For example, for me, my name is Stephanie Giselle, and they were referring to me as Stephanie in some paragraphs and as Giselle in some others. So I found that to be like a continuity kind of like error. So I just said, hey, is there any way that you can just write both names at least, or something like that, or just stick to one?
So this is what I envisioned when I change it or write it up. I envisioned the end of my clerkship that I receive, I'm assuming, a PDF of what of my evaluation and of my comments. And then I figured, imagining how this works is I get a Word document and I basically kind of transcribe it into.
Oh no, they do it. They have an outline of how they do it, so they'll send it to you.
Okay.
And like I said, you just you can make additions too. For example, they talked about, you know, me being a good student, whatever, in undergrad. And I was like, make sure you talk about me being a vice president in AMSA because I sweated my off to get that position. And I want to show them everything good that I've got, because that's what you're supposed to do. And so I asked them to add that I was part of the medic, that I was part of AMSA, and that I was part of this like thing they did back when I was in my first 2 years of medical school. It was like a scholarship thing. So I was like, make sure that you mention all of those good things so they can add stuff, obviously, if it's true. And, you know, like I said, change up, like fix my name. But that was it. So I gave them comments on what they sent to me, but they sent me like a finished product or finished rough draft. And I just double checked, sent it back with my comments. They sent a new one with all of the changes made. And I said, good. And that's what they sent. So I didn't get to like write out anything.
Okay, good. I'm glad because I was kind of thinking, how would I know what
what to write?
No, not like what to write, but more so format. It was like, you know, I don't know what is expected. So I was like, I don't know how to do this, but I'm really glad that it's not the case.
No, don't worry. You'll just have to do a revision. That's it.
So in terms of letters of recommendation, how many did you get and when did you ask for them?
For internal medicine, most programs will want 3 letters. A few couple will want 4, but it really is rare. So someone told me at some point, and I can't remember if it was like a person who told me or a video that I watched, but I heard that if you have to have 3 letters of recommendation, ask 4 people. Because if for any reason, any of those people can't write you that letter of recommendation, you will still have your limit for your, you know, minimum of 3. So knowing that, I thought about the people I wanted to ask. And knowing that I possibly wanted to go into internal medicine, I talked to the internal medicine attending my first week of rotations. So not my first day, the end of my first week. And that's because I wanted to see if the attending was nice. And I've heard people that talk to them the first day. I was like, no, but I want to see if they're nice, because I want a good letter of rec. So I waited until that Friday of my first week, and I mentioned it to them. And I was like, I think it would be great if I tell you now so that you can start evaluating me from the get-go. You get to know me in that way. And it really helps because they pay more attention to you. They say, oh, that girl wants a letter of recommendation. And sometimes they'll challenge you even more. So I asked week 1. And then at the end of my rotation, I reminded them. I said, you know, thank you so much for a wonderful experience. By the way, I just wanted to remind you that I will be so interested and so grateful on a letter of recommendation, something along those lines. And so they gave me their email, or they would say, oh, I'll give you a contact for you to reach out. And so they'll let me know. And then 3 months before the application was due, so September, August, July, so I guess July, I can't remember well, I sent out the email asking, you know, it was a really good email. I worked on it for like a couple of days.
I bet.
Just basically saying, hey.
Big deal, yes.
Yes, I Googled what is the best way to email someone about a letter of recommendation? And I read a bunch of like, not samples, but like, yeah, I guess examples on what to mention, what not to mention, and all of that jazz. And so I sent out the emails to the physicians. So at that point, I had asked the internal medicine physician attending, the surgery attending, because that was the second second rotation I had that I knew I was interested in that residency. I didn't ask peds because at that point I knew that I wasn't so interested in peds. And so I knew that I had to have, you know, the letter of recommendation from the physician whose specialty is the same as the specialty I'm applying to, right? Mm-hmm. So I asked to those two. I asked for a to the neurologist for a letter of recommendation. Oh, pulmonology, the pulmonologist doctor. And so I had my four letters. I was so lucky to get all four. None of them, you know, said I can't do it anymore. They were also willing to help. They sent them out in time. Because you ask in a few months in advance, you still don't have access to My ERAS, which is the portal for your application. So you can't give them access for them to send out the letter. So obviously you have to remind them again when it's time for you to work on your application. I got my four letters and I just decided to send out all four. I was like, I just don't want to forget. I just don't want to skip one program that needs four letters. And I guess it'll just look better. Mm-hmm. And that was my personal thinking. I'm not really sure if it looks better or not, but I was like, I'm just going to send out the four. So when you send out the letters, you are given an option if you opt out or not to see your letter of recommendation before it's being sent. And it always looks better if you opt out from seeing it. So I did that. So I wasn't able to see my letters of recommendation. But I have heard that some doctors will work with you. So some attendings will work with you in your letter of recommendation. Like I was expecting them to be like, no, I won't write that letter of recommendation, or, you know, I'm going to test you more because you want a letter of recommendation. It wasn't like that. They were also willing and also nice. And, you know, during my interviews, I was told that I had good letters of recommendation. So that's good. So that gave me more reassurance. I was like, okay, so they were nice.
Oh, that's great. In terms of letters, mm-hmm. did you need a program director's letter for medicine?
So some programs will want a program director's letter. Oh. Some programs will highly desire a letter from your program director. So that's part of the research you have to do. Some of them do require it. So if you don't have one, maybe you don't apply to that program. But if it's highly desirable, go ahead and apply. Maybe you know, if it's highly desirable and you don't have it, but they still like you, I think they will, you know, look the other way.
So it's by school. It's not really by specialty.
Yeah, it's by the program.
So I was wondering, how many hobbies did you put, or what were your hobbies?
Okay, so yes, there is one, and there's only like 100 characters. So you have to be very specific and short on your answer. So what I did was wrote down the hobby and then a little explanation on it. Somehow from one of the YouTube videos I watched from the previous applicants, that girl who I was watching, she was able to fully talk about her hobbies. I guess she had more characters than I did at that point in time. So hopefully you'll have more. I wrote down 4 hobbies. I'm really into art. So I draw and paint. So that was like one of them. I'm also big into running. So, you know, that was my 3rd. And then my 4th was like DIY crafting. And it really doesn't matter what you write. I know some people have written down, like have a YouTube channel, or some people like video games, like an avid video game. What are they called? You know, like the people who play video games and like win things and stuff like that.
Yes.
So it really depends on like if they ask you about it, how you talk about your hobby, the passion you show about it. So I only had 4. I mean, even if I had more, I don't know if I would have had space for more, but it's just expressing who you are and letting them know who you are, that you are more than just a person who studies, that you like plants, or that you like to knit, or that you like to, I don't know, watch soccer games every Sunday at a bar. I don't know. So it really just showing your personality. During interviews, at some point, one of the faculty mentioned that they had noticed that they had a bunch of like musically inclined candidates, and during that specific interview, I was not one of them. But he said, "Can you raise your hands? I saw that a bunch of you do music." And so one of them was like, "I do piano, and I do the violin, and I do the guitar and the violin." And I was like, "Well, I do nothing, but I'm still here." So it was just a comment that they made. So they do read sometimes, that section about your hobbies, but it's just adding to your application and just showing, so that the programs know who you are outside of just grades and letters of recommendation.
I have to ask, so when you said about people raising their hands, are you talking about other interviewees?
Oh, okay. So this is, maybe I guess I didn't know this either. So because of the Zoom interviews, it's kind of, you go in, you log in, and it's kind of like a class. So you have the program director, the coordinator, and then you have all of the interviewees for that day. And so it could be 5, it could be 10. It really depends on the program. And so each one of them will have an interview at a specific time and with a specific faculty. So I'm sure you know that Zoom has the option for you to be placed into a room. Mm-hmm. So when it's time for your interview, you and the faculty who's interviewing you are placed into a room. So you're taken out of the bunch. At the same time, they usually do 4 or 5 interviews. So 4 or 5 people are taken out into different rooms, and that's when you do your interview. And then when you're done, you're sent back into the main room. And so you're interacting with the other candidates, you're interacting sometimes with residents, so you are asking questions, or you're just talking to the candidates. So it's pretty cool because you get to know people from all over the world or from all over the country with like different interests, and you just learn more about them. And honestly, it helped a lot because you don't get as nervous anymore going into your interview. You have been talking to these people you just met. So going into an interview with someone you're just meeting, it makes it easier. So that's how they work. So for example, during that time that the faculty asked about musically inclined people, we were all in the chat room at the same time. I think they were about to send us out, I think we were done, and it was just a comment that he made. So we're all muted, but we're all our faces are there. So if he asks a question, we can raise our hands and stuff. So yeah.
Oh, okay. No, I definitely did not know that. I thought it was just a direct link into it. Mm-hmm. Okay. So do you have a full day with them as well, or is it, because I think when you go in person they do a lunch thing and then an interview?
So in person you would typically have lunch and then a tour and then your interviews, because you will always have more than one. Mm-hmm. For this new era of Zoom interviews, you do have to take a lot of the time from your day, and it really depends on the program. I had an interview, I think my shortest interview was 4 hours. So most of them start at 8 in the morning, 7 in the morning, 9 in the morning. And they give you an introduction, a PowerPoint introduction about the program. They also show you videos about that's your tour. They show you videos about the facilities. Some of them introduce you to faculty through videos. And so, yes, those 4 hours, they seem long, but some of them go by really fast. I think my longest interview was about 7 hours. So Yes, during interview season, you have to be mindful of having a flexible schedule. If you're doing rotations, they will obviously give you time to do your interviews. A lot of the people who were being interviewed had their scrubs on, and they would have to like change really quick to get that interview. Like I remember one person said, I just walked out of the closet and here I am. Obviously not to the faculty, but like to us, as we were interacting. But yes, be mindful of your schedule. If like for me, I wasn't in school anymore, I wasn't in my rotations, so I had that flexibility. Even though I was scribing, I was able to call out and say, hey, I have it these days, I'm busy these days because I have an interview. And because it's like within the medical field, they understand, so if you're not doing your rotations anymore and you're graduating, be mindful of what your plans are so that you can have that flexibility to have your interviews, because yes, they will take up half of your day or maybe your entire day, and it will be constant. So yes.
In terms of certificates, did you put any in your ERAS application?
So I just had the good old ACLS and BLS. My application wasn't that great in the certificate section. But I do know that some people have their EMT or what's another one, like CNA. So people who have worked as that in that section. For me, I had just graduated from undergrad going into medical school, so I didn't really have much background other than ACLS and BLS. I'm sure there's even there are other certificates you can get, but I don't think you should be too worried about that. It worked for me with only 2.
That's actually
yourself
why I'm asking, because that's the fear of not having enough and stuff like that. But you matched. So if you had to, when you matched, like it gives me hope, and hopefully whoever's watching this hope as well.
Yeah, it is really a person-to-person case. Like some people will have 3 or 4, but that's because their life has led them to have those, and it's good to seek out for like great things to put on your application, but don't stress yourself out too much. There are more important things than the certificates.
Is there anything that you included in your ERAS that we haven't talked about?
Yeah, I think there's one important thing that I should mention that maybe not everybody knows about. I didn't, and it's just kind of going off of what we were talking about. My ERAS application wants you to write down all of your school endeavors from medical school, but also from undergrad. So like I said, I didn't have research in medical school, but I did in undergrad. I did a few things in medical school, but I was very active in undergrad. So if you have a really good CV from undergrad, or if you do like a ton of volunteer work, or even just like things to highlight who you are from undergrad, those things will help. They will see those things because it is a compile of everything from undergrad and medical school. So you may think, oh, I only have 2 things of volunteer work from medical school, because obviously it's hard to do things outside of studying. But if you have done stuff in undergrad, those things count too. So just make sure you go back and check your CV from undergrad, make sure you have the dates right. And if not, start digging, because you can include those things. And I think that's something that I don't know if everybody else knows about. I didn't, but it does help, and it makes your application longer, heavier, thicker.
Right.
And research is not just paper published kind of research. If you have done oral presentations, poster presentations, those things count too. So, there's still time, obviously, if you want to include some research. But yes, there's way more stuff that you can include, way more certificates, if you had stuff going on in undergrad, or achievements, like, oh, I was given the gold medal for, volunteer work in undergrad. That's great, and you can include that. So that's something that I didn't know, and that's something that I was able to include into my application, and it just looked better because you don't have a lot of time to do things in medical school. But I'm sure we all were pretty active in undergrad, so that'll help you.
In terms of matching, I have two more questions.
Yeah.
One is, what do you think helped you successfully match?
I think it's just making sure that, like I said before, you know yourself more than anything. The interviews carry a lot of weight in terms of where you end up matching. And if you're not yourself, they might just, turn over the page, the grading page. They notice those things, especially because you are nervous. And when you're nervous, you might not notice that you're showing things that, maybe you're being robotic, maybe you're not being yourself. So yes, be yourself. Then this is during interview. Just overall, your school career and all of that. Don't pay too much attention to like the little details. Like I said, the certification. I think they focus on three things the most. The first thing will be your step scores. They do focus on those things, obviously, especially because a lot of the programs have a minimum step score to be considered for interview. So yes, studying and getting a step score above the qualifying range is good. But I know that you guys have like the pass and fail now for step 1, so maybe now you can focus on step 2 and get that good grade up. So yeah, for me, I went through this cycle that still was seeing both grades, so step scores were important. The second thing is letters of recommendation. In many of the interviews I had, they mentioned the letters of recommendation. And so that tells you that they place a lot of emphasis on those things. And the third and most important, I think, to not forget about, because a lot of people forget about this, is your personal statement. And I'm saying this because not only it's like the one thing they know about you aside from your application, but I had a bunch of interviews where the program director had read your entire application, top to bottom, side to side. They knew you from your application, your scores, everything. But the faculty, like the other people who were interviewing you, had blinded interviews. And what this means is they are only given your personal statement to review. So the first and only impression they have of you is from your personal statement. And you know that first impressions are important. So before they even get to see your face, they have only read your personal statement. They don't know your scores. They don't know your dean's letter. They don't know if you have research. They only know what's on your personal statement. So focus on that personal statement. I started working on mine like 5 months before. And I started off with one idea, ended up with something completely different. I was able to have really good friends who helped me revise it, people that I knew from college who had gone into English, who had gone into like literature, those things to check to make sure that, I was being concise, that I was being, that it was flowing, that I was showing my ideas. Something else that I did, and I don't know if this was like cheating, I went into the website. Well, before that, have you heard of like when you apply for a job on your, what is it called, the cover letter, to make sure you add adjectives that they're looking for on their on their job application. So I went onto the websites of my like top most liked programs, and I read their mission statement, I read their goals, I read like the welcome thing, and I looked for adjectives too, things that they want in a resident, and I made sure to include those in my personal statement letter. It was just, making sure you focus on those things and obviously do your research. I watched tons of videos on YouTube and just like making sure how to fill out the application, keeping up with the dates, keeping up with everything. It's a lot. The application alone took me a while to finish. Obviously, I did everything prior on Word before like copying and pasting to the application. and just understanding like all the dates. Like I said, ECFMG, the deadline is this in December. Make sure you get it done before. EOT, the EOT test. Make sure you know when you're supposed to take your interview, when you're, keeping up with all the dates. Your dean's letter takes about 1 month to be released, so don't wait until the last minute. And I think if it's just a matter of, the match is called the match for a reason. Like, you have to have the characteristics that they're looking for, and they have to have the characteristics that you're looking for. So focus on what you want to show and what you want to receive from a program, and I think that'll take you a long way.
Follow-up questions. In terms of your personal statements, did you do multiple and then just submitted it different for your top ones that you changed the adjectives to, or did you?
No, it really became like a very cohesive personal statement. For it really fit a lot of the programs, and especially the programs I was interested in. However, in your personal statement, you do have to mention the specialty you want to go into. So if you're applying to more than one, you have to do more than one personal statement. But no, I was happy with mine. I was happy with how it ended up. And I just submitted the same one to every single program.
You said you have to include internal medicine. Are there other requirements for personal statement?
They're not requirements per se, but there are things that you need to add. For example, what your plans are after residency. And it's gotta be brief, because you don't have, you can make a 20-page personal statement if you want, but who's going to have the time to read all of that, especially nowadays that because of Zoom, more people are applying to programs than like they are used to, so they have way more applications than before, so they have to be more concise. I think my personal statement was like a page and a half, or maybe even less, and be concise with what you're writing, but also be like explicit. And that sounds, I know that's contradicting, but like that's why you have to start from early. I have heard people that start their personal statement in January, February. I didn't do that, but it takes a long time, especially if you want to portray, if you want to make sure you portray like everything that you need to portray. In my personal statement, I talked about myself, who I am. I talked about internal medicine and how I came up with, I ended up choosing that. I talked about my future plans and said my goodbyes, and that was it. It is something that you have to work on. I think my first draft was like almost 5 pages, and it's really, really hard to like take out things and like sort out what's important and what's not. But that's why you have to have people who know you. It has to be someone who knows you, who can read it. Obviously, you can send it out to people for grammar check and all of that, but at the end of the day, it has to come out sounding like you. It has to show who you are, and it has to be, presentable and professional and all of that. So it is a big deal. That's something that you got to work on from way before. And I think that's like the biggest homework that we have aside from the tests and such. Work on that personal statement and give yourself ample of time. And those are the things I included. I don't know if, in the future, they may suggest or advise to include something else. But for my experience, that was it,
I'll definitely, I kind of say this to everyone that I interview, but I honestly mean it. I will come back and watch the video for myself, because there's so much that we have to keep up with. So yes. I will forget, even though I've heard it, understand it. I just, thank you so much. I appreciate that.
No problem.
Present and future me appreciates this.
Good.
Okay, in terms of matching, I know that you matched. However, I was wondering if you know what you know about soap and the the scramble process?
I know a pretty good bit about it, just because you always have to be mindful that, you know, your plans might not happen the way you want them to happen. And so I did my research. I even watched or, you know, was invited to seminars, and I, you know, did the seminars and stuff. So basically what it is just, so match week is a week that is dedicated to match. On Monday, you get to know if you matched or if you didn't. And then you have to wait a week until Friday to know where you matched. So for a whole week, you don't know where you matched. But that's the good side of the coin, like the positive side of the situation. If it's Monday and you received a message saying you did not match, you have a second chance, in which all of those programs that have unfulfilled spots or unfulfilled spaces, let's say program A typically has 20 incoming residents, but only matched 19, they have one extra. All of those programs that have extras, they will be given the opportunity to find people to fill those spots. So that's where the unmatched candidates come in. So that same day, on Monday, you are given the list of all of those programs with unfulfilled spaces. And basically, you have to do your research, and you can apply up to 45 programs free of charge. And throughout the whole week, you go through an interview process with them. And on Thursday, there are 4 rounds where you interact with those programs you apply to. And if they liked you, they will give you that spot. And that's how you find residency, basically. You don't match because the algorithm didn't match you, but at the end of the day, you do find a residency spot. So it's like a second opportunity for those people. So it's really good, and you know, it's worked for a lot of people. And it is a stressful week, and you have to understand the process just in case you don't match. But it helps a lot of candidates.
Personally, I heard about it through Twitter. I literally just saw soap, and I kind of was like, oh, what is that?
Yeah.
And, you know, and so that's why I've included it now in my questions, just so that we can learn more, be familiar with these concepts. So my last question for you would be, what would you recommend overall for UAG students to focus on?
Yeah, I think the first thing I would like to emphasize is that being an IMG is not a bad thing, or it doesn't make you any less worthy of residency than like the US medical students. So don't think that by being an IMG you have less chances. The statistics are there, yes, there's a less percentage of matched residents if they're an IMG, but that's kind of like already giving up, you know? Just keep thinking that you have everything that you need, and you have everything that they want. So don't think of yourself as less just because you're an IMG. I think that's the first and biggest thing. The second thing would be enjoy it. The 4 years go by so fast. Yes, you have to focus on studying. Yes, you have to focus on classes or clerkships, but don't give up that precious time, that precious extra time you have on just medicine. Because I mean, for me, for example, my family is really important. So dedicating time to your family, or, you know, your significant other or your pets, that's still important. And it's part of that having like a good mental health as well. Because if you just focus on studying in school and, you know, doing well, it'll just drive you crazy. And it happens a lot, and a lot of people, you know, go through a lot mentally. And I think if you give yourself, you know, 1 day out of the week to just focus on yourself and your family, or people you care about, or the hobbies you care about, I think it'll help you more than regretting every hour that you didn't spend studying. Because at the end of the day, you're just giving yourself more stuff to worry about, right? Like I was always like, oh my God, I spent 2 hours on a movie and I could have been studying. Don't do that. Like if you want to watch a movie, and then you can make it up later by like actually focusing on your studies. But sometimes quality over quantity is best. So, you know, focusing entirely on your study time is good. Don't get distracted during your set study time, but also give yourself gym time, family time, pet time, boyfriend girlfriend time, anything that can help you escape, because residency will be harsh. I'm not even there and I'm already like, oh. But yeah, it's a different lifestyle for a doctor, so make sure you enjoy those things, and take care of your mental health. I think that's the biggest thing.
Yes, thank you so much for touching on mental health. This is kind of my conclusion of video. I just really wanted to say thank you so much for taking the time to thoroughly explain to us how your journey and how-tos of basically everything along our first through fourth year.
Yeah.
And I really wish you the best in your internal medicine rotation. I know I now follow you on Instagram, and so I will definitely just look out and support your journey.
Thank you.
It's very inspiring to see, one of us essentially, make it and succeed in the US. And I know that great things are in your future, and I really appreciate your time and guidance.
Thank you so much. No, and thank you for having me. And you're always welcome to reach out. I'm always willing to at least talk about my experience, because I feel like I didn't really have someone to talk to. So I want to be able to at least, tell you about my mistakes or what you shouldn't do. And, it's equally inspiring to see someone who's working this hard, super clever to have this channel to reach out and to just help out your fellow classmates. And I think that speaks volumes about your character. So thank you so much for that. And I also wish for you the best. I know you're going to be a great doctor. So just keep working hard.
Doctora. No. But no, thank you so much. I appreciate it.
All right. Well, we'll keep in touch.